Well, last Friday was the last day we had to get policy bills out of committee. So that's the first hurdle our bills go through. And if they don't get out of policy committee, they don't move forward. This week, the bills are going through the fiscal committees, and that's the next hurdle that they have to face, is whether they get out of those committees. And then after that, they head to rules and then to the floor. Well, we've done a lot of work in this area, and we need to. We have a higher rate than the national average of suicide, and we also have the highest rate of teen suicide in the United States. And so it is something we've committed to. And so in the past, we've done required training for mental health professionals, for medical staff, for counselors and psychologists in schools. And this year, we're looking at a bill that would actually impact higher ed. And we have two high-risk groups in higher ed. We have young adults, which are a high-risk group, and we also have veterans. We have a record number of veterans who are going back on their GI bills. So this really has the higher ed sitting down and looking what the best practices are and how they can support and provide more resources to students that might be experience mental health issues or potentially suicidal. Well, I was approached several years ago by a woman by the name of Jennifer Stuber, and she's a professor at University of Washington, and her husband had committed suicide, and she learned so much more after that and realized there wasn't a lot of training provided of really how do you manage someone who has suicidal symptoms and what kind of treatment do they respond to. And it really was an opportunity to team up with her and the University of Washington and other survivors and say, you know what, we know it's preventable. We can do better. And so these efforts we've been working on really are moving us a step forward to really, at the end of the day, saving lives. There's two pieces I have. One is around the suicide prevention. We have been encouraging the trainings to address the unique issues of veterans, and we found that the trainings coming out do not. So we're actually going to require it this year, that they all integrate a piece. And that's especially important because we have a lot of people who have served multiple tours, who are part of the National Guard, who actually are going to seek their health care in the community. So it's very important that our mental health professionals and medical staff really understand the unique situation they face. And so we're moving that forward. And then I also have another bill that would help veterans at the county level get streamlined into services that they need.